Good day, I'm Jackie Judd. Preventive health services are a central piece of the healthcare overhaul law. The notion of prevention seems pretty straightforward, but it's not when cost and health outcomes come into play. That's true for the government and for private health insurers. Kaiser Health News columnist Michelle Andrews, who writes Insuring Your Health, is here to walk us through a surprisingly tricky issue. Welcome, Michelle.
Hello.
It's been over a year since the overhaul law was enacted. Just kind of bring us up to date, remind us what kind of preventive services are, for some people, now free and also considered a standard part of care.
If you belong to a health plan that's not what they call grandfathered, a plan that was in existence as of last fall and this year when you signed up hadn't changed much, then you're in a new plan, and those new plans have to provide a number of preventive services for free, including many cancer screenings and bone density tests, as well as vaccinations and HIV testing. There's a whole range of things that now have to be provided for free.
What is on the table, and what's the timeline for some decisions to be made?
There's a whole group of preventive services for women which are yet to be decided, and they're being discussed right now. I think the timeline is sometime in the next year or so that they'll determine which benefits for women in particular have to be added.
Prevention, as I said, it kind of seems like a straightforward idea, but it's not when you look a little bit more closely. There is a school of thought that sometimes we as Americans overdo it with testing. So what are some of the trickier issues that these experts are working through?
Well, there's this idea that prevention always saves money, and therefore it's a good thing from a health system perspective. Mm-hmm. And in fact, that's not the case, because it costs money to do preventive services. And if you're not likely to get a particular type of cancer because you're not a particular age, for example, then maybe screening for that isn't cost effective. But there are also issues around the process of screening just in general, that if you don't have any symptoms, maybe it doesn't make sense to screen for something, because whatever you have might never have been a problem in the first place, and you're putting yourself out there and having procedures that in and of themselves have risk.
Employers, of course, the insurance industry, they're very much involved in this debate. And some, in rare cases, insurance policies are beginning to reflect values associated with certain preventive screening tests. What is it about, and where do we see it?
Well, the idea of value-based benefit design can be applied across many different kinds of health services. And the idea is that an employee pays out of pocket based on the value of a service to his or her health rather than its price. So if it's critical that you stay on top of your blood pressure medication and take that every day, for example, or get a particular screening for cancer because it's in your family, then you might not pay anything for that. Whereas something that is perhaps not so beneficial, like a knee replacement, not beneficial for everyone, in some cases obviously it is, then you might have to pay much more for that out of pocket.
So who determines the value, and is the value relative to particular sets of people? Older people, younger people, as you say, people who have family history of cancer? Is it that specific?
Well, I think it can be. You know, in some cases we know the science has said, well, if you have a family history of breast cancer, you're X percentage more likely to have it yourself. So we know some things. And then also I think employers look at the kinds of services that they see a lot of that aren't necessarily critical. What comes to mind are sleep studies. One employer I talked with said, you know, all employees were getting sleep studies, you know, and that's not necessary. So they actually started charging employees more for sleep studies.
Okay. Thank you very much, Michelle Andrews.
Thanks.